Good morning, everyone. We're just going to take a moment to let a few people join us before we start the official conversation. Nice to see you again, Sania. Tammy, hi. Hi, Caroline. Good morning, everyone. Thank you for joining us on this third day of winter. I'm Kelly Jebb. I am on day 7 as the CEO of Peak Care, and I am thrilled to be opening this wonderful webinar on a topic so near and dear to my heart, youth mental health. I'd like to begin by warmly welcoming you all to take part in this conversation. It's really great, actually. From mental health services, health, education, research, community orgs, government, everyone's here, and from across Queensland and the country, which really speaks to the national relevance of this issue and the shared commitment to improving outcomes for children and young people who've experienced maltreatment. Before we begin, I'd like to acknowledge the traditional custodians of the lands on which we all meet. For me, I'm on Meanjin, Brisbane, and I pay my respects to the Yagara and Turrbal people as the traditional custodians of this land. I also acknowledge the strength, wisdom and resilience of the Aboriginal Torres Strait Islander children, young people, families and communities who continue to nurture their cultures, share their stories and uphold their knowledge systems. And I'd also like to acknowledge that today is Mabo Day and recognise that that was a remarkable act of courage and resilience and determination. At Peak Care, we are privileged to work alongside organisations and communities who support children, young people and families every day. Through that work, we consistently hear about the challenges faced by children and young people to access the supports they need to address the profound impacts of maltreatment on their mental health and well-being. While we've made significant advances in our understanding of child maltreatment and its impacts, too many children and young people continue to encounter systems that were not designed with their experiences in mind. And that's why this project is so important. The development of a youth mental health framework for resilience after maltreatment seeks to move beyond individual programs and services to consider what conditions need to exist across our systems and to better support healing and recovery. Importantly, this work reflects a shared ambition across sectors. The strong participation in today's webinar demonstrates that there can be widespread recognition. There is no single organisation or discipline or system that can solve these challenges alone. So today's webinar is an opportunity to share some of the early insights emerging from this work, including what practitioners and leaders and stakeholders, including many of you from across Australia, are telling us about the resources and conditions and system features that support those effective responses for children and young people impacted by maltreatment. In a moment, we'll hand over to the brilliant Lottie Harris, who will take us through the project and some of the emerging findings. But before we do, I'd like to invite Erin Blapiak, Executive Director of Strategy Impact from the Queensland Family and Child Commission, our partner in this work, to share a few opening remarks. Over to you, Erin.
Thanks so much, Kelly. Thank you for the excellent introduction to this initiative, and good morning to everybody. Thank you so much for contributing your time to joining us today. For those that know the Commission, you would know that we deeply value our partnerships and our research agenda, which are both key contributors to us achieving our strategic objectives. We're proud to partner with ACU and with Peak Care on this joint research initiative. The Commission is legislated to oversee the child protection system and to facilitate the Child Death Review Board, which is an independent body that reviews the deaths of children connected to the child protection system within 12 months of their passing. And as such, we present insights and recommendations to government to influence systemic change in the best interest of children and families, particularly those that are connected to these systems. Sadly, child maltreatment and mental ill health are themes that are echoed through a lot of our work and unfortunately are also very under-researched. And as this partnership research initiative with Peak Care and with Dr. Lottie Harris, with Professor Daryl Higgins from ACU, it aims to address some of these gaps and to build a solid foundation for some positive systemic change. Dr. Harris is a foster carer and postdoctorate research associate with the Institute of Child Protection Studies at ACU. And with practice experience in the out-of-home care and youth homelessness sectors in New South Wales. Her research areas of interest include health responses to childhood maltreatment and trauma-responsive system design. And she's very driven by the commitment to ensuring that good outcomes for children are not just left to luck, but are supported through consistent, high quality and evidence-informed care. And over to you, Lottie. Thank you so much.
Thanks, Erin. Thanks, Kelly. And thanks all for being here. Yeah, it's a real privilege to be able to share our project, and yeah, I've been looking forward to this. Really hope to have some good quality conversations with you all about the project, either today or beyond. So as has already been introduced, our project's titled A Youth Mental Health Framework for Resilience After Maltreatment. And today we're just going to go through some early project findings and basically bring you along our journey of the project. But before I go any further, I'd like to acknowledge any First Nations traditional owners, custodians of the land on which we are meeting today. I'm coming to you from the land of the Tubbagar people, which is Wiradjuri land. It's central west New South Wales. And I just want to pay my respects to all elders, past, present, and emerging, and any First Nations colleagues on the line today. Really value your input at any point, but particularly today and at this critical stage of our project. So thank you. As I briefly just kind of said, today we're taking you along our journey of this project. We're smack bang in the middle of it. And so I want to emphasize that this sharing today is not any definitive kind of findings or outputs or outcomes of our project, but really it's a bit of a tester, a teaser of what we're finding, and hoping and a call to share your thoughts and perspectives and help us shape the project in its next phases. Don't think I probably need to share too much information on the links between childhood maltreatment and mental ill health. I think that's pretty well established and has been for a long time, but just as a setting the scene piece here, the Australian Child Maltreatment Study has been critical in our understanding of the prevalence of maltreatment in Australia, and I was fortunate enough to work on this data over the last couple of years. Some of the key, takeaways is that maltreatment is really highly prevalent. Over 60% of Australians reported that they'd experienced some kind of maltreatment. And other research along the way has shown that, about 75% or 3/4 of mental ill health begins in adolescence, or at least before the age of 25. So this is clearly a really important issue to understand the landscape of youth mental health, particularly related to child maltreatment. So my work and this project really acknowledges the incredible importance of prevention. Of course, we absolutely need to prevent child maltreatment from happening. But I sit on this the end of having a duty of care to respond to the needs of children after maltreatment has happened. And so that's where our project sits, supporting them after these experiences. Again, I probably don't need to situate this with any of you here, but just for the sake of leading you along the journey of our project, I want you to just kind of think about two children who you probably all are very familiar with. We've got Ali and Jaden. Both are 12 years old, both have experienced child maltreatment, and both are showing signs of maltreatment-related or mental health, mental distress. And just wanted to really quickly showcase how different their experiences of accessing care can be and where our kind of stumbling gaps are in systems. So, see, Ali, she's been in out-of-home care for almost 2 years. She's had a couple of placements, and every time she moves to a new placement, there are new assessments, new therapists, new services, new mental health plans, new behaviour support plans, and each team starts to interpret her needs differently. And so her access to trauma-informed mental health care really depends on what and how the information about her needs and experiences are shared. The ability for teams to accurately interpret her needs, relationships between agencies, and then what funding is accessible. I mean, that's just four points where her care depends on, but there's actually a lot more, of course. But then Jaden, he is in a different situation. He's living at home with mum. There is statutory intervention, but family are really, really trying, though there is still some instability there. His pathway looks very different to Ali's. He's been referred to a generalist service. He's been placed on a wait list. His school that he's engaged in well with, they're worried, but they are really unsure where to escalate his needs to. And his family have, really struggling to understand how to navigate multiple systems, multiple services. And so his access to trauma-informed mental health care then depends on different things. It depends on how mainstream services understand, respond to, recognise trauma-related behaviours, responses, mental health concerns, the availability of services in his local area, individuals' capacity for advocacy. So his mum, his teacher, how do they advocate for his needs? And also depends on who and what entity or what person takes responsibility for coordinating his care. So this is just two examples of two children demonstrating kind of common practice problems. So some of the ways in which systems really struggle to provide for the needs of these children will be totally familiar with you. And we're going to put a poll up in the chat about how prevalent these issues are in your day-to-day work and life. But some of the common struggle points are that when children and young people have experienced child maltreatment, their symptoms or how they present really cross diagnostic categories. There's no surefire way to categorize or put into a diagnosis the experiences of childhood maltreatment, and that unfortunately still does dictate a lot of eligibility for services and funding, and so that's one of the issues. But unclear accountability, and you probably would be all feeling this frustration. Someone says, no, that's trauma, that's over here. No, that's disability, that's over here. That's mental health. No, we don't deal with that. It's this roundabout of who's taking accountability for these young people's needs. We also have a fairly limited number of specialist evidence-informed services specifically for this cohort in the country. And so that's where Jaden gets referred to a generalist service, which maybe is not fully equipped to respond to his needs. And then the last one there is that we've got pretty, on the whole, a lack of flexibility to support complex presentations that really require a holistic approach, but our service system at this current moment doesn't do that collaboration particularly well. That's just a snapshot of the practice issues at the individual level, and I'm sure everyone can attest to those challenges. They make getting children's needs met really difficult. At the research side, we are seeing a lot of research around children's individual needs and And then also the capabilities and practices of those individuals around them, what they need to be doing. So providing that direct kind of psychological intervention or relational care, cultural connection. We're seeing emerging evidence around those needs. What is less known and what's less researched is that kind of outer layer of our diagram there, the structural resources and conditions that then allow the therapeutic web around a child to provide those practices as a standard without having to go above and beyond systems or finding loopholes to be able to provide therapeutic really healing practices. What do we need to make that standard so that every young person can access high quality care? So that's why, as a partnership, Peak Care, QFCC and ACU have come together to design and develop this youth mental health framework for maltreatment healing or resilience after maltreatment. And our intention is to design a cross-sectoral framework that provides clear, structured evidence on how policymakers, agencies, practitioners can all redesign the service systems at the struggle points that I've mentioned. So not a whole system reform. We're not at that point arguing for that. Somebody else maybe can argue that. But what we're doing is just providing evidence on if you want to redesign some of this existing service structure, what would that need to look like? So that's what we're trying to do. We're consolidating, building new evidence on helping system designers make really evidence-informed decisions for this cohort particularly. Essentially, we want to give Queensland a roadmap for building a mental health and child welfare system that really truly supports mental health resilience after maltreatment has occurred for that surprising, well, not necessarily surprising, large cohort of young people who experience maltreatment. That's the essence of our project. The approach we're taking in a nutshell is that our data piece is in 3 phases. And I guess I've been explaining it as phase 1 is the why. We're exploring the gaps in systems and where those struggle points are, where children are missed or ill-served. That's phase 1. Phase 2 is the what. What do they need? What is essential to have in place at the system level so that, you know, we have that standardized quality care? And then the how. How do we make sense of those needs in the current system structures that we have? How do we implement the identified components of system design so that every child gets high quality care? So today I'm just going to walk through briefly each of those phases, sharing some preliminary findings and then sharing what phase 3 is going to look like, because that's at the point we're at now. Phase 1 and 2 are, fairly well established, but phase 3 is the next part. So phase 1, a big part of phase 1 was a review of, or a big policy analysis. So policies and also practice guides and things like that. Anything that had a focus on delivering mental health care for children. That was what was included in our analysis. And basically we were asking, when these policies talk about children who've experienced maltreatment, how do they imagine their mental health needs? What assumptions about these children is being used to guide decisions in policies currently? What help or support is actually available for these children according to the policy landscape? And what opportunities do this group of policies afford children to be able to access the care that they need? So this is forming one part of our framework to see at the policy level, where are the gaps? So just as an overview, as a snapshot, these are some of the policies included. Of course, I couldn't add all of them on the page, but primarily it's a Queensland focus with a few national policies. And we're not necessarily deep diving into each one. Well, sorry, no, that's not true. We are deep diving into each one, but our analysis is taking the whole landscape as a whole to say, in Queensland, how are children and young people supported to have their needs met according to this policy landscape? Very early findings. some themes that are coming through, and it'd be interesting to hear in the chat or in Q&A later as to whether this you feel this reflects your what's happening in your day-to-day work. But childhood maltreatment seems to be referred to as just another adverse event. So it's under this category, under this umbrella of adversity, where other things fall into that, like bullying, poverty, racial discrimination. And there's not very few policies articulate what childhood maltreatment is. There's rarely any ever outline of the different types, the different characteristics of maltreatment, like age of onset or severity. And this kind of, it reads as though maltreatment is equal to or just another event. But we know that's not necessarily the case. There are very specific, significant effects of childhood maltreatment that are not the same as experiencing poverty, for instance. That's one of the key themes that are coming through. The second is that although maltreatment is listed now often as a risk factor for mental health challenges, there's very little limited discussion of the mechanism in which child maltreatment affects mental health. And so, yeah, there's just very limited depth in that pathway. It's rare to see any mention of attachment issues, developmental challenges or disruptions, any impact onto social, cognitive or emotional responses to maltreatment. And so when these mechanisms of harm are missing, it tends to lead to kind of generic service responses. And also maybe this assumption that the specifics of how maltreatment operates is not important for treating young people, where again, we know that very much is. It's imperative that we understand the causes of mental health issues for these cohorts to properly provide intervention for them. And then emerging themes that are also coming through, but less concrete at this point, and that's just because our analysis is still underway. But there is this broad acknowledgement across policies that the current service structure is hard to navigate and explicitly not designed for complex cohorts. That's what it says in many of them, which leads to our cohort to say, well, where do they go? How do they fit then? Generally, there's just limited systemic attention to the known barriers that we have got research on about accessing mental health care for this group of children and young people. So yeah, please do share your thoughts on these early findings. I'm zipping through them because there's a lot to get through, but love to have more of a thorough conversation with people if you have particular thoughts on this stage. That was our policy analysis, and we will be publishing and providing lots of reports and things on our web pages and out there once we're a bit more once this is more concrete, so please do follow along there. Second phase. Now, you may have been aware that we published a survey recently. So this is the what, all right? It's what practice, clinical, structural elements are essential for children to build resilience after maltreatment, but specifically, what structures and supports do the adults around them need to be able to help them navigate their mental health needs? So as a brief snapshot of our survey, which ended 2 weeks ago now, we had about 50 items that we asked participants to rank in importance. And those 50 items came from a whole range of research that's already been established around what children need. We wanted to start ranking if there were particular ones more important than less important. And so we had 2 survey versions going, but we're asking essentially the same kinds of questions. We had 225 responses, which is really fantastic, especially for a very resource and time poor sectors and caregivers and young people. So that's been awesome. And I'm just going to very briefly kind of go over some of our findings. Some of those items that were top ranked, some of those really important things participants were saying are essential to provide the therapeutic web around children and to enable their effective care. And so I'm going to list just 6. These are not ranked within the 6. These are just popped out there. So just because this one's at the top, it's not the most important, but very early findings suggest that effective assessments that explore more than diagnosis-related symptoms for children must be the foundation for decisions about their further mental health care. I should say as well, no doubt, a lot of these essential features will be totally familiar with you, and you'll be going, yep, absolutely, this is essential. This is more just a consolidation of, perspectives and this ranking piece that we're doing. Another item that was considered highly important was that there's long-term investment in services that are dedicated to support children and young people after maltreatment, so that they're not expected to engage with generalist mental health services. A couple more. There's this piece about social prescribing. Essentially, mental health care should be involving connection to culture, connection to country, mentorship, that would not ordinarily be involved in clinical mental health care, but seen as a really important feature of caring for and supporting this group of children and young people. Then another item was about the specialist trauma training, the focus on attachment, developmental adaptations and physiological processes that are associated with childhood maltreatment. Training on that level that is traditionally kept within the realm of, specialist mental health clinicians and things. We need to broaden that training out to universal service providers who care for children in various ways. That was an important feature that came through from our survey. And then finally, two more on the items that were ranked was having a funded interagency liaison role. Now, I think this might be somewhat similar to the health liaison role in Queensland, but it had some specific expectations to that role as well. And finally, what was considered essential was, regardless of whether children go to specialist services or generalist mental health services, there should be adaptations to service delivery for those children. So things like extending the engagement timeframes, having animal assistance in there, and maybe doing some outreach, meeting in different locations rather than the clinical room. So as I said, they were a series of items that were ranked very highly in terms of what systems can provide for children and young people. And this is such a snapshot of our qualitative findings, because we had a lot of qualitative input into those surveys. Essentially, we asked, what are we missing? And out of all those items, and we had some really important pieces come through here, though just be reminded, very early stages of analysis. But comments from participants about service models should be providing parallel support for adults to provide. So in order for them to provide therapeutic care, they also needed to have addressed their own and processed their own maybe child maltreatment or adversity related challenges. And so that there was a consideration that systems also ought to provide care for the adults. We got peer-based and lived experience supports should be core components of systems, not just qualified clinicians. There was obviously a big piece on professional care, people providing care in a professional sense and enabling them to have reflective supervision and not just managerial oversight in their supervision, having a space to debrief and really think deeply about what these children need. And then having some kind of navigation tools or systems so that people who are not familiar with or not professional, not working in these systems, can navigate supports easily. So that is a very, very quick snapshot of our findings. As I said about the policy findings, we will be publishing, we'll be sharing all of this data in different ways, in different methods. So please keep following our project. The final piece of our whole project is the third phase, is focus groups across Queensland. So and this is the how. How do we operationalise the findings from our survey into real life, and so that it can inform child welfare systems and mental health systems in Queensland as they are currently? So I'm sharing with you about our next phase one, so you can have an overview of how our data is collected, but also as a call to, not call to action, but a request for action. People, if you are interested in this project and have perspectives and have ideas, or know of people who do, please share them with us. So between June and October of this year, we're intending to run a whole series of focus groups in Queensland for this purpose. And as just an example, now it is still in progress and we're still refining our methodology and approach, but generally our sessions are probably going to be centered around these three kind of implementation questions. So given the data from the survey, what needs to be in place so that all children who experience maltreatment can reliably experience this kind of support? And when I say this kind of support, we're going to tie that back directly to various findings we had in the survey. So it might be the assessment process, or it might be the kind of support in terms of adapting mental health service delivery. So we'll tie those questions all back to the data that we already have. Another question we might have is what can make things difficult? What can make this difficult to achieve in the current system that we have? And what would help, kind of those system levers, what can help your local mental health or child welfare systems move closer to this approach now? Again, these are just tentative questions that we have, and we would really like some input or some ideas if you have to support our approach here. Our intention is to run focus groups, as I said, across Queensland, June to October. We've got quite a long period to gather a variety of inputs, but generally we would like to run focus groups with young adults aged 18 to 25 with a lived experience of child maltreatment. We'd really like to hear from caregivers, parents, carers, someone with a lived experience of child maltreatment. We would hope to hear how they struggle with or find helpful navigating systems as a caregiver. And then also we would really like to hear from professionals in the various sectors around that operationalizing what needs to happen at systems level. And then we're open to other groups. You know, as I said, this is really, we are at the planning stages of this. So if you have ideas about other cohorts that would be useful to gather data from, we're all ears, all open. We're also very open to running focus groups either online or in person across Queensland. We don't want it to be just limited to Southeast Queensland or Brisbane. Very happy to travel into various areas to get a good representation of data there. And we can do interviews if focus groups are not appropriate. So that's our plan. Now, I realise I have rushed through all of this and we are well under time, because I was going to leave it there to say, if you would like any more information, please get in contact with me, or we have project pages on our either the Peak Care website or the ACU website. We'll be posting things on there. So please do keep in touch either through either means. And I just had a little note there to say, look, if you are interested in providing more input into our project, but you're not based in Queensland, that's completely fine. Please do get in touch. We can discuss that. Yeah, the point of this project is to gather as much data as possible by the end of the year. So we won't limit it to Queensland if you've got some really pertinent, important things to say. So that is the end of my presentation. Yes, I had anticipated and I had practiced and that it was going for much longer, but here we are. It gives us a lot of time for a Q&A if anyone has any thoughts or questions. I will hand over to Taylor.
Lottie. Maybe we should, we've actually got a poll that we prepared also, Lottie. Should we run the poll while people maybe think a little bit about whether they've got a question or not? So there was just a poll that we prepared around which of these practice problems are the most challenging to navigate. So I'll launch that now because I'd be really keen to hear your thoughts. And I think yeah, we'll see how
Yeah,
that one
let me get
goes.
to, I'll bring back up that page that was relevant for. Yeah, just it's really helpful to hear where the struggle points are, because that might also help us with our operationalizing of the challenges we could, you know, what's the word I'm looking for? Just tailor our data collection for various challenges. So
Definitely. And so it looks like we've got a fair few coming through. So particularly around limited specialist services, Lottie, and
yeah,
service models are siloed. Looks like limited specialist services is kind of pulling ahead with about 44%. A few more results coming in though. Yeah.
yeah. And then I just curious about when those specialist services are available and working, how are they operating, and what makes them effective, what makes them efficient? That's not necessarily for now. That's just a query I have in my mind all the time about, because it is so limited. I've had really great fortune to go and visit a bunch of specialist services across different states, and there are pockets of exceptional work, but it's really geographically based and then not scaled. And yeah, so it makes total sense that this would be the one that's pulling away.
Yeah. Definitely. And there's been some great comments in the chat. So thank you so much, everyone, for posting your thoughts in there. We've been reading through them and we'll share them back with Lottie as well. But yeah, we do have time for a few questions. So if you have any questions, please feel free to drop them in to the chat, and we'd be happy to answer them now or follow up with you at a later stage.
Yeah, happy to flick back and forth
Yeah.
between different slides as well. I do acknowledge that I zipped through them, so if anyone would like to read through some, yeah, let me know.
And if there is no other questions, the links are, just drop them in the chat for you all to our website pages. Really, the intention was to just share with the sector the fantastic work that Lottie is doing on this project, and to provide an opportunity to let the sector know what we're working on, and to engage if you want to learn more. So please feel free to get in touch by those contact details if there's anything else that you want to learn about. Cool. Okay. Well, unless there's any other questions that roll through. Oh, we've got one coming in. Thank you. So we've got one just around, Lottie, if you've looked at any other systems outside of Queensland. Have you seen any examples of states that are doing well? Thank you, Lockie, for that question.
Yeah, thanks. Thanks, Lockie. Yeah, looking at other systems. So actually, we took a broad approach to begin with. So we went looking at literature and research around the whole of the country, and then we are narrowing it down to Queensland. That's our focus. But yes, so as I say, any other states doing it better or well or differently? I have found that everyone is struggling with the same kind of issues: the lack of services, lack of systemic practice in this area. Yeah, I have found that there are pockets of really effective, amazing work. Found some department-funded, really good mental health programs in the ACT, but they are so limited. They are so small. They can see a caseload of maybe 20 at a time, and that is just not enough. So in answer to your question, no state or territory seems to be doing it consistently in the way that we would hope. Some states and territories might have more pockets and more examples of really good work, but not at a system standard level. But if people have things that I should be looking at, please send my way.
Yeah, definitely. And Lottie, there's just a comment in there from Sophie, just around, input from caregivers and young people into the questions and approach. So did you want to share a little bit more about the approach that we've been taking with that?
Yeah, thanks, Sophie. And in doing this webinar, we did really skim over a huge chunk of our project, but it's a very good point that I want to make, is that we have so less caregivers, but young people. We have a really we've been working with some really engaged young advocates with their own experiences of various things, who've been giving us some fantastic tips and ideas around how to run our focus groups effectively and safely, and those specific questions we are liaising with them about. Caregivers, though, it's a good point, and this is an area that probably we need to put more emphasis on. So if you have any ideas on liaising with the caregiver group on supporting our design or our approach, or if you have ideas of how caregiver groups can participate, please let us know. This is the point of this conversation, to help us direct our approach. Thanks, Sophie. Evolve, yeah. Thanks for putting Evolve in the chat. Very keen to explore the Evolve approach. Thanks, Sophie.
Great. Great questions. Thanks so much, everyone. I'm wondering if there's any other burning questions going to come through. But that's fantastic. And yeah, it's great being able to do a webinar at this point, hey Lottie, where we can incorporate some of the input that we get from you all. So thank you.
Yeah, it feels really quite meaningful, because usually you do a webinar at the end of a project just to share what's been done, but this feels like I'm really genuine in saying, if you have ideas, if you have thoughts, we can incorporate that. It's got to be meaningful for the sector, so please, yeah,
Thanks, Sophie.
please do. Yeah, thanks. Great.
Oh, Lockie's got one more question. So also just around if we're looking at the link between childhood trauma, mental health and disability, particularly within NDIS changes.
You know what, Lockie? Yeah, NDIS seems to fall under the radar a bit, and it's absolutely something that needs to get back on our radar. Thank you for that. I mean, we're looking at all elements of system design, so NDIS needs to be one that we need to put more focus on. You're right. If you have any thoughts, love to chat at some point.
Great. Okay. Well, I think we may wrap it up at that point, Lottie. And yeah, contact details are in the chat. I might just reshare those links now in case anybody wants to reach out or get involved further. But yeah, thank you so much, everybody, for joining us today. And thank you, Lottie.
Oh, thanks everyone for your time and input. Hope to hear from you all soon.
Thank you.